Good evening, everybody. I'm about to be joined by Dr. Ringler from California Fertility Partners, and we will be discussing how they are operating during COVID and the safeguards that they have put in place, and also talking about how international patients can start the process now, even with COVID happening. And very excitingly, they are donating a free cycle of IVF to us as part of our global fertility clinics versus COVID initiative. So someone will be able to benefit from that, and you can apply via the link in bio. So we'll talk a bit more about that during the call. I'm just going to see whether he's here. Should be here any second. And obviously, if you've got any questions about COVID and the vaccine and the way that they're working, then please ask as we go along. And I don't know, do people know about the Fertility Clinics versus COVID initiative? Did you know that we are giving away 7 free rounds of IVF with our fantastic clinical partners or donor sperm to help people we can get back on their feet around. If you don't know about it, head to the link in our bio, our website, fertilityhelphub.com, to find out more. And Dr. Ringler is just joining now. Good evening. Hello, good day to you.
Hi, nice to meet you. It's nice
How are
to
you?
see you. Good, thank you.
And so I've just given a brief introduction, but please could you say a little bit more about yourself and California Fertility Partners, and then we'll go from there.
Sure. My name is Guy Ringler, and I'm a fertility specialist with California Fertility Partners, where I've been fortunate to practice for the last 30 years. We have always been pretty well known in the area of reproductive medicine because our IVF lab is credited with helping to make some of the world's first IVF babies. So we've always had a large number of patients who come to see us internationally. So that's easy for us. And of course, the internet makes it very easy to communicate with everyone around the world, around the clock.
Absolutely.
And, as you know, the pandemic has affected everyone. And when it first started in March, we slowed down a bit and instituted multiple different safety programs to make it safer for patients to continue their reproductive care. And we are, moving forward. We're about 80% of our normal patient volume. And, what's nice about it is I think everyone needs something positive to look forward to. And what's more positive than planning your family?
Absolutely.
Making babies. And so it's going well.
Fantastic. And what kind of safeguards have you had to put in place to make sure that there's that level of safety and to reassure patients, etc.?
Well, when patients call to schedule an appointment, they're asked questions about their exposure to COVID, potential exposure and potential risk. And they're questioned again at the time that they check in for their appointment. Patients cannot bring a spouse or partner with them. They can only be seen individually, and we spaced out patient appointments to minimize the number of patients that are waiting in the waiting room at any one time. So patients are waiting in their cars until the exact time of their appointment before they come into the office. All of our office staff wear face masks and face shields the entire time because we want to minimize the risk for everyone, for our patients as well as our staff.
Of course. And do people need to self-isolate during a cycle so that there's no risk of bringing COVID in between appointments?
We're fortunate our patients are very health conscious, and everyone is being very protective. Most of our patients are working from home, and they're really minimizing their exposures. So that helps protect everyone.
Absolutely. And what about the vaccine? What are your thoughts in terms of, we're seeing a lot of people, as you probably are as well in your clinic, worried about how the vaccine they might think it might affect their fertility or cycle outcome. What are your thoughts and recommendations on that?
Well, I think, when the vaccine becomes available, everyone should talk with her or his physician about whether it's a good option for them. In general, I recommend it for most patients because it's one of our only protections against the virus. The American College of OBGYN and the Society for Maternal and Fetal Medicine both recommend that it be offered to patients. and patients should make a decision for themselves about what's best for them.
Okay.
You need to consider your risk of exposure, your risk of infection to the virus. You need to consider the potential risks of the virus during pregnancy, then the potential risk of the vaccine, which is felt to be very safe and should not pose risk during pregnancy, although it hasn't been studied in pregnant women.
And which vaccines are available in the States at the moment?
Currently, we have the Pfizer and the Moderna vaccines available, and there's being rolled out in phases. So it's currently available for healthcare personnel and individuals over the age of 65.
Okay.
So currently for our patients undergoing treatment, it's not available for them yet unless they work in the healthcare industry.
Mm-hmm. And what about patients who are in between vaccines or concerned about whether to have one or if they're offered it, just as they're about to have treatment? Would you normally advise patients to wait until they've had the vaccine or continue with their treatment?
You know, it's recommended for all women who are planning to get pregnant or even women who are pregnant for consideration. And I recommend to my patients to receive the vaccine when it's available. Currently, for most of our patients, it's not available yet, but hopefully we can, you know, increase the amount of vaccine available and to allow more people to have access to it.
Absolutely. And you have just written a wonderful article, which is on the Fertility Help Hub website, which I will be posting about tomorrow. So people can head there now through the link in the bio to find it. And one of the things that I really enjoyed reading about, and obviously getting to know you more and the team, was the fact that when you see patients, you have that personalized care the whole way through their journey. So tell us a bit more, for those of people watching who don't know about California Fertility Partners. How does that work in terms of personalized care? And also, how does that work for people who aren't necessarily located in your state, or for patients who might be in Europe or international?
Okay. Well, for all of our patients today, whether you live in Los Angeles or you live in London, we start with a Zoom call rather than an in-person consultation. And once our patients are in treatment, what's unique about our program is each patient is seen by his or her own physician at every appointment. So rather than hiring ultrasound technicians to perform ultrasound exams, we perform those procedures ourselves because we make very important decisions based upon those exams, on the data gathered. And so we believe that it's helpful and important to do all those exams ourselves. It also gives us an opportunity to answer our patients' questions. So a patient undergoing an IVF cycle, they see their physician 5 or 6 times before the egg retrieval rather than seeing ultrasound techs and never getting a chance to get your questions answered. So I think it keeps our patients well informed, and it helps me to make the best decisions for them to help get them the best possible outcomes.
I think for patients that's key, isn't it, in terms of the continuity, so that you build up a rapport with your specialist and you have a sense that you're kind of on the journey together and things are being, obviously, of course they will be, but knowing that things are being monitored very, very closely and that you're following that journey with them. Someone's just
said, the continuity of care is very important because I want to get my patients the best quality eggs, the best quality embryos, and that's a concerted effort by everyone on our staff, myself, my nurses, my embryologists in the IVF lab. We're all committed to giving our patients the best possible chances of conception.
Absolutely. And for anyone who's joining, if you have any questions for Dr. Ringler, then please do ask, whether that's about the treatment that you're offering at the moment or treatment from coming abroad, how that looks at the moment, or whether it's about the vaccine, because, you know, especially at the moment, as you will be finding, it's such an uncertain time, isn't it? And even though the vaccines are being rolled out, I'm not sure where the case numbers are in the States at the moment, but they're not good in the UK. And we are all in lockdown, and we've been in lockdown off and on since November. And there's no sign of it ending until the vaccine is, you know, has been rolled out further, and so we could be looking at the summer before things improve. Where are things in the States at the moment?
Well, in California locally, fortunately, the numbers are starting to go down a little bit. So the positivity rate is going down, hospital admissions are decreasing, ICU admissions are decreasing. That's the first time we've heard this in a long time, so that's very encouraging. And I think, you know, I feel fortunate that our patients, because they're young and healthy, they are in a low risk category, and everyone is really committed to staying safe, for themselves, for their children at home if they have children at home, and for their future children. I see a lot of surrogate mothers for patients both, locally and internationally, and I'm very impressed with their commitment to being safe, not only for their children at home, but for the pregnancies that they're carrying. Because you're right, this isn't going away quickly, so we need to do all that we can. And for my surrogates, I am recommending the vaccine when it becomes available to them.
Mm-hmm.
I think that's the safest way.
Absolutely. And have your team been vaccinated? Have medical experts been, able to access that for treating
Yes,
people?
because we're in healthcare, I'm fortunate. I had my second dose of the Pfizer vaccine 3 weeks ago, when it was available to us because we're seeing patients daily. So that's very helpful, and it's a wonderful feeling once you have the vaccine, knowing that you have some protection against this,
Yeah.
nasty virus out there.
Yeah. I mean, I've had COVID. I had it at Christmas, and I've still got lasting effects of it. So I think you call it long haul COVID over there, don't you? And we call it long COVID.
Right.
It's such a nasty thing, and it's great to hear about these safety measures that are being taken, because obviously it's such as we said, a daunting time, but also you don't want to be jeopardizing anything to do with the cycle, do you, when you've worked so hard to get to this position?
Absolutely, and we've always seen many international patients who would fly here for their treatment cycles, and of course, with the flight restrictions, they are not able to fly here for their egg retrievals. However, for our men in Europe and around the world, we do have centers in London, in Germany, Switzerland, that will freeze sperm for us. So we are able to freeze sperm, do all our required infectious disease screening on those specimens, and have the sperm sample sent here by courier. So for individuals who are planning a family through egg donation and surrogacy, for example, we are able to continue with their care.
That's really good. So in normal days or normal times, what percentage of your patients are from abroad, and what about from the US?
I think for myself personally, I think it's 50-50,
Is it?
50% international, 50% locally. For my partners, they have a little more local percentage, less international. But we've always seen patients from throughout Europe and Asia who come not only for the high quality care, but for treatments that aren't offered where they currently live,
Mm-hmm.
including either egg donation, surrogacy, gay family building.
Mm-hmm.
So we have every treatment option available here. And,
Fantastic. And I know you mentioned this earlier, and you mention it in the brilliant article that you've written, which everyone should go and read. You talk about your state-of-the-art laboratory. So what are the kind of cases, if you like, or treatments that have successfully happened there that have been revolutionary, I guess?
Well, 4 years ago, we built a new IVF lab from the ground up. I've been practicing here for 30 years. My senior partner, Richard Marr, has been practicing for 40 years. So that's really the beginning of IVF. And, we have changed offices and changed labs, but we always want to give our patients, the highest level of care and the latest technology. So 4 years ago, we built a new lab from the ground up, featuring a highly purified air system, state-of-the-art incubators and equipment in order to give our patients' embryos the best possible conditions for growth. One big change 3 years ago was a continuous culture system. 25 years ago, we would look at embryos every day to assess their growth and development. But that means you'd have to take the petri dish out of the incubator every day to look at the embryos under the microscope. And every time you take that dish out of the incubator, it's exposed to changes in temperature and pH, which we have learned over the years can have a negative impact on embryo development. So today we look at the embryos the day after egg retrieval. It's a fertilized egg or one-cell embryo. And then we keep the embryos undisturbed in culture until day 5. So they're kept in their continuous culture environment. And we're finding higher rate of blastocyst formation, higher quality embryos, and higher pregnancy rates. So we have a very committed team of senior embryologists who are constantly reevaluating culture conditions, changes in the laboratory to see what we can do to improve embryo development, to improve pregnancy rates.
Would you do transfers at day 3?
Pardon?
Would you do transfers at day 3?
We don't do transfers on day 3. We continue all embryos in development to the blastocyst stage because today the culture conditions are so good that if an embryo is going to make it to a pregnancy, it has to make it to a blastocyst stage. So we keep them in culture to see if they do or not. If they don't become a blastocyst in culture, they're most likely would not have made it if placed in the uterus.
Yeah, that's great.
And most of our patients today want to do genetic testing of the embryos.
Yes.
So once the embryo reaches the blastocyst stage, we can biopsy it by removing 3 to 5 cells from the outer layer of this 100+ cell embryo, freeze the embryo, and send the cells to the genetics laboratory, and they'll tell us whether or not that embryo contains the correct number of chromosomes. So this is called pre-implantation genetic testing, or PGT, and this gives us very helpful information on which embryos to transfer because we know whether or not it contains the correct number of chromosomes.
Do you recommend that to most of your patients?
I do, because the testing is so accurate today. Our embryologists are so highly skilled in the biopsy procedure, freezing and thawing of embryos, it gives very helpful information, especially in our patients who have a large number of embryos. It helps to select the embryos for transfer.
Yeah, absolutely. We've had a couple of questions, if you don't mind. Someone has said that they're 37, they've just finished their 5th IVF cycle. They have 6 embryos and they're currently waiting for the PGS results. If everything goes to plan, I will do an ERA test next month and transfer in April. Sorry, that's not actually a question. Someone has asked, should I wait until I have the vaccine, or would it be safer to transfer before I take the vaccine?
I think it's fine. You have to evaluate your risk of contracting the virus, what the exposure you have to it, what the level is in your community. And you also have to curious when the vaccine may be available. If the vaccine is going to be available within a month or 2, there's no harm in waiting to do your transfer. However, if you don't know when it's going to become available, I would not hesitate to do a transfer now, because you can take the vaccine once you are pregnant. We don't know of any harmful effects during pregnancy.
And I guess as well, it probably depends on the circumstance and the age of the patient as well, I presume.
Yeah, it sounds like she has a nice number of embryos. It's really, it's a question that she should discuss with her healthcare provider, her fertility specialist, to find out what's best for her particular situation.
Mm-hmm. Thank you. Going back to COVID first starting, let's say a year ago, when it all sort of spiraled, did you have to close your practice at all?
Well, we followed the recommendations published by the American Society for Reproductive Medicine, and at that time they recommended that we stop doing new treatment cycles. So we completed our patients who were in the middle of a treatment cycle, but we did not start new treatment cycles until the recommendations changed, because we didn't know the impact of the virus at that point. And so we're slowed down to a minimal number of patients for about 6 weeks. And once our professional organization sort of gave us a green light to begin to continue care, then we started patients back in treatment. And, we all learned how to continue to treat patients and to do it in a safe manner.
Absolutely. Yeah. And do you think that from moving to seeing people in person at the beginning, do you think it works well doing it remotely? Do patients mind that? Are there benefits to it, do you think?
I'm sorry, I didn't
As
quite.
in, do you think that for some people doing, let's say, a Zoom call to have that first consultation, do you think some people prefer that rather than having to come into the clinic or take time off work or be there with their
That's a
partner?
That's a great question. It's so convenient now.
Mm.
The whole world has changed to Zoom, right?
Mm-hmm.
Because we can accomplish so much via a Zoom call. Yeah, I think many patients do. It's just easier for scheduling. It's easier for most people. Eventually, the patients will come in because I want to, because we're so hands-on in our practice. It's really important for me to do the ultrasound of the uterus to make sure there aren't any uterine factors that could be having a negative impact on my patient's fertility. I want to do the ultrasound of her ovaries. I want to see how many follicles are present, because we receive a lot of clues based upon our assessment that it's always best to do those assessments in person. But initial intake history and discussions about treatment options is actually very easily accomplished over a Zoom call.
That's really good, especially as you said, for international patients. They can start that process now rather than worrying about travel being restricted.
Absolutely.
And we just had another question around intralipids and immunology. What are your thoughts on that, especially at the moment?
Intralipids and immunology?
Yeah.
We don't give intralipids. There are some centers in the United States that have used lipid therapy for reproductive pregnancy loss, and this is not part of our treatment regimen yet.
Okay. So we've had quite a few other questions come through. So how can patients be reassured that with false negatives, we're not discarding of what might be viable good embryos when PGS testing comes back with low grades?
Sorry, I didn't capture all of that.
I think they were basically asking, with PGS testing, how accurate is it in terms of the results coming back and the concern of discarding embryos that perhaps could have been okay?
Right. That's an excellent question, and I think in general I can say that accuracy is upper 90s%, and I think as the embryo biopsy procedure has progressed, as embryologists have acquired greater skills in doing the procedure, and as embryologists have acquired greater skills in the freezing or thawing of embryos, as the PGS companies have refined their testing, these have all added up to giving us more accurate results that we can feel confident in. The one area of question still are mosaic embryos. Mosaicism means that some cells are normal, some cells are abnormal. And the biopsied cells are really biopsied placental cells. They're not biopsied fetal cells. Most of the times the genetic results are the same, but they can be different. So in cases of mosaicism, it's very important to discuss with your doctor the pros and cons of transferring that embryo. Is it transferable? Is it best not transferred? In the embryos that are read as normal or clearly abnormal, I think those results are highly accurate. I think the questions come in as to the mosaic embryos.
Fantastic. Thank you for explaining that. Do you have time for one more question?
Sure.
Someone has said that they have PCOS and they have an AMH level checked, which was high at 172. Can this affect IVF success? Well, I guess can this?
Well, we know that
women indication for that.
With women with PCOS, their ovaries are very sensitive, so in general they make a large number of eggs. There could be more variability in quality of those eggs. I think it's very important that they are monitored very closely during their treatment, because we want to obtain enough eggs. We also want to obtain the highest quality of eggs. So for a woman with PCOS, we would monitor her extra carefully to not to overstimulate her ovaries, and to obtain the highest quality eggs possible through close monitoring and careful titration of her medication. But yes, she can produce large number of euploid normal embryos, which should give her a high chance of pregnancy. There's always some safety in having a larger number of eggs, because we know that a percentage of eggs at any given cycle will be abnormal, and that correlates with age. So by having a larger number of eggs, even if you are a little bit older, should increase your chance of having a normal embryo from that cohort of eggs.
I remember I went into a spiral of Googling percentages of what my success rate would be based on the number of embryos that may be lost, from other people's cycles, which was never a good thing to Google, because obviously it just depends on your personal circumstances and body and situation, doesn't it, versus what may have happened to someone else.
Every case is different, so that's why treatment must be individualized. You can't give everyone a standard recipe for an IVF cycle. So we, look for signs from the ovaries, from those ultrasound measurements. That's very helpful data. If patient has cycled previously at another IVF clinic, it's always important to review that data to see what it tells us about her ovaries, her egg quality, to see what we can do to try to improve it. Egg quality is determined by age, it's determined by genetics and lifestyle, but also how we stimulate the ovaries. We want to stimulate the ovaries to get enough eggs and mature eggs, but we don't want to overstimulate, which can decrease the quality of the eggs.
Yeah. Thank you for that. So, they said thank you very much. Someone's husband has chronic pain and has to have medication. Is there any medication he can take safely without affecting his sperm? I think that's, again, probably quite a personalized diagnosis.
Yeah, I think that's a question he should have with his reproductive urologist.
Yeah. Okay. And thoughts on using growth hormones to improve egg quality?
I've used it occasionally. It's not part of our standard protocol. There are some studies that have demonstrated that it can improve egg embryo quality in certain individuals. It's definitely on the list of possible adjuncts.
Okay. Well, thank you so much for answering those questions. And also, as I mentioned before, you've written a very insightful article all about your facilities and your expertise and introducing your team at California Fertility Partners, but also talking around the COVID vaccine. So if people want more information, it is all there. Head to the link in the bio to check out that article. And also I want to say a big thank you for coming on board our initiative to give away a free cycle of IVF to a person or couple who's been affected by COVID. It's an amazing thing, and giving those we can a sense of hope. So thank you for that. And again, if people are interested in finding out more why California Fertility Partners are part of it, then please go read this article and you'll see where you can find out more and apply if you're interested. So thank you very much, Dr. Ringler, for your time and for speaking tonight. Great to speak to you. Thanks, everyone.
Okay, bye-bye.
Bye-bye.